is starting this spring, we're going to start utilizing the real virtual reality therapeutic package here. What that's going to do is allow our patients to be engaged in a virtual reality environment that will total immersion virtual reality, which will allow them to do tasks and exercises and perform functional activities in manners that they wouldn't be able to do in reality. Maybe somebody who has a loss of range of motion will be able to reach higher and hold it longer as they're engaged in this virtual world. And with that comes not only just strengthening of muscles and gaining flexibility, but also some changes in the way the brain is wired. And with that comes even quicker and more benefit with the therapy. And it's something that they really enjoy. While they're here, they're distracted from some of the pain or some of the limitations. And for that hour, they are playing. And with that comes another part, enjoyment part of the brain that makes healing even better. Any patient that struggles with any kind of loss of balance, limitations in any type of movement, this will help them. Also, pain patients, people who are suffering with pain and are limited, having them do exercises and activities in this environment will have some changes in the brain chemistry that allow some of their pain to be better managed. Ms. Atkinson struggles with balance and mobility, and she's come a long way. She's kind of plateaued in a sense, and we've kind of hit some times where she needs to go above and beyond what we were doing here. So putting her in the virtual reality immersion system allow her to be competitive with herself, do things that we can't perform here, catching flying things or trying to dodge things coming at her in a very safe environment. It will allow her to see herself doing things and being successful in doing those that she can't naturally do here right now. And with that comes some confidence and some changes in the brain that then allows her to be more flexible, better balance, better improvement with functional activities. Virtual reality is something that's been around for a long time. We've all seen it, but the research is really starting to show that doing activities in this virtual reality setting just provides a lot of benefits from strengthening, from range of motion, from flexibility, pain management, and with this new cutting edge therapeutic benefit, we want to be part of that. At Sinsmurphy in general, we try to pride ourselves on being innovative and not only just things that we provide, but also our thought processes and the way that we treat and the philosophy that we treat people with. Is hopefully current research-based innovation. So Mr. Reyes had a incomplete spinal cord injury at a level in his mid-back, and so him being in this virtual reality environment, he was able to participate in activities where he was reaching and moving and using what we call mirror therapy, to where if he moves one body part, it makes both body parts move at the same time. And what that does is it again works on not just his strength and range of motion and control of his trunk, but also starts mapping new pathways in his brain that helps his movement be better and more accurate and just improve. When I did it, for the moment you're in there, you're kind of lost. You are really in a virtual reality. For the moment you forget kind of where you are, and you're so engaged in what's going on around you that you do kind of you use distraction as a benefit. You forget that you're at work, you forget who's around, you're doing these silly movements, and you kind of are so engaged in accomplishing the task at hand that you kind of forget what's going on. You're being distracted from your own limitations, and you're so engaged in this artificial world that those things kind of get pushed aside, and you're competing and you're trying to catch these fish and you're trying to shoot these balls, and you kind of forget that you have these problems and limitations. And it's funny, all these people today, they all go, I really enjoyed that. And we go, do you not usually enjoy therapy? And they go, oh, no, I do, but that was fun. And that's part of it. I mean, you want to be engaged in something that's fun. If it's needed, it might as well be fun when you do it.
It's just more fun than a barrel of monkeys.